Hi, I'm Ola Landgren. I'm professor of medicine and I lead the myeloma program at the University of Miami. I'm here today in beautiful Miami at the Miami Myeloma MRD Meeting of 2025. I'm here together with my long-term friend and colleague, Dr. Dickran Kazandjian. We work closely together at the University of Miami. We are just about to kick off the meeting here, and there are a lot of new things in the field of MRD for myeloma. The reason we started this meeting over 10 years ago was really to push it over the goal line to the FDA and make MRD a regulatory endpoint. A lot of people told us that's never going to happen, right. It's not a good idea, but we actually delivered that last year. So what are your perspectives on this, Dico?
I think it's wonderful. I think it shows how persistence kind of pays off and is important. I mean, I think it's been about 15 years we've had these meetings, and sometimes meetings feel like, they don't go anywhere, but actually this is the proof of principle where if you keep pushing on, if you keep making friends, collaborators, and work towards the same goals, and really our goals are all the same, and that's to provide better care for our patients and really decrease their suffering at the end of the day. And as you mentioned, MRD is an important, key piece in that. And so to actually see that come to fruition, I think is wonderful. I mean, it's been wonderful for my own career to be part of it and to grow up with it.
I share exactly the same perspectives, and I think that for people that listen to this that are maybe in the beginning of their career, to me, an important message is if you work on something that you believe is important, don't give up, because people will usually tell you it's not a good idea, it doesn't work. But if you believe in it, keep on working on it. And I think if it's related to patient care, it's related to outcomes. If you see there is a path forward, these are the important things you need to really stand up and work for. And that's what we have done together.
Yeah.
I think still there are a lot of things that we need to do in addition after the FDA approval that you pointed out here before we started filming. It's actually the annual anniversary today, right?
Right. It's a celebration actually, because it's been 1 year since that, and it's the first time that we actually come back together as a group and really discuss where our momentum is going to take us for the next steps all together.
Yeah, so a whole year has passed, but we are now here together actually for the first time in a virtual hybrid environment where we have almost 1,000 people registered online. We have almost 100 people here at the meeting in Miami. So we are now united here after the FDA approved MRD as an early endpoint for accelerated approval a year ago on this day. Questions I think are important going forward are how can we use MRD to develop a cure for myeloma? We don't yet have an established cure, and I would envision that if we have the best therapies, if we can really make sure there is no disease left behind in the individual patient, that could be a path towards the cure. I also think that MRD can play an important role, and it already does, to steer the therapy for individual patients. You can increase or decrease intensity. You can even forego certain steps. You can forego additional combination therapy cycles. You can forego transplant. You can forego combinations or maintenance. You can go down to less intense maintenance. There are so many things you can do.
No, absolutely. I mean, I think our drugs are getting really good, and it's wonderful to see high, response rates, MRD negative rates, progression-free survivals. But we also have to sort of accept the elephant in the room that we are over-treating a small percentage of patients. And MRD could be that tool to actually guide, which patients actually need more therapy. And one day it could also be sort of, guide what type of therapy in terms of mechanism of action or other things.
I agree with that. And MRD, as you point out here between the lines, that MRD could be viewed as positive, negative, but there is information also for guiding a therapy. What type of cells are there left behind? Maybe MRD will give information on targets. So we could think of MRD as a more sophisticated tool in the future, and there are a lot of technologies. And that really takes me to think about another important thing I think with this meeting is really to talk about technology. Because technology will always get better. And I think having blood-based tests, having tests that can maybe be imaging-based and other types of technologies, and to drive the field forward in a united way, I think that's an important task for this meeting going forward.
Yeah, no, I agree. I mean, I think there's no question MRD is an earlier, marker we can use to do all these changes in patients. But now the next step is how do you do it so that you can check MRD as often as you want without causing significant morbidity in terms of the procedure for the patient?
Right. I'm really very excited. We're just about to kick off the meeting here. Are you ready?
Me too. Yeah, I'm ready.
Well, let's
go.